Hi there, it's Matthew from Menlo Park Recruitment.
And Victoria from Menlo Park Recruitment.
Hi there, everyone. So we ran a really successful webinar series recently, of which Victoria and I delivered the first one, which was all about what to look for in a practice. And in this episode, we're going to briefly recap some of the discussion points that we've covered and some of the questions that were raised as well, to give you an insight into the full length episode. And hopefully, it inspires you to go and watch the full thing. Um, the first section that we discussed was, what to do before you inquire, and there's a lot of things you need to be thinking about before you actually make that initial inquiry. How much does the advert tell you? The quality and the quantity of the information. How forthcoming are they with things like salary and working pattern? Um, Look at how many other practices are nearby, and that can give you an idea of how competitive recruitment is, and how easy it might be for that practice to recruit more GPs once you're part of it. Like, it's not just you joining. You need to think about the recruitability of the practice in the future as well. Use your network too. Do you know people who work there, or have worked there? Can you tap into anyone, and get a bit of an inside scoop? We talked about the importance of how long has the advert been live and what that can tell you. It does, a practice that's been advertising for a while raise any alarm bells with you? You can look at the CQC rating, the patient reviews. I think both of these are good indicators, of how a practice is faring. Is it commutable as well? Look at the distance. Have you travelled that far before on a regular basis? Think about it in the winter, particularly when it's dark mornings, dark nights. Do you really want to be doing that kind of commute, when the weather is rubbish and it's dark and gloomy? Think about the population, the demographic. Have you worked with that patient group before? And I think finally, for the initial part, look at their website as well. How much information is readily available to you? What can you find out? Similarly to what information is in their advert, how much can you glean before you actually make that initial contact?
Thank you, Matt. So that's some great advice when you make your initial interest in a practice. But what about when you make your inquiry? So it's important to state clearly what it is you're looking for. It's important that you set your stall early, gain nothing from keeping your cards close to your
No,
chest, as you just risk wasting everybody's time, including your own.
it
State your
doesn't. Yeah, it doesn't
requirements.
benefit anyone.
No, absolutely not. And so, I mean, we've come across this before, haven't we,
Yeah,
Matt, where people haven't divulged, for example, can't work Fridays,
yeah,
and then they've said it when an offer's been made, and that's a game changer for the practice. So
yeah.
make sure you let us know exactly what you want right from the very beginning. State your requirements. What do you need in terms of flexibility or support, professionally or pastorally? You have outside of work commitments that you need to ensure you finish by a certain time. Practice will try and work with you where possible. Ask when they're looking to recruit. A practice in a hurry to recruit might be to your advantage in terms of leverage, getting what you're looking for. Could
Mm.
also suggest desperation, so just be aware of that as well, and never feel under pressure to make a decision on a start date.
Yeah, I think that practices will always wait for the right people, won't they? And I think if they're giving you, a week's deadline, to come back to them on an offer, perhaps I think they need to be appreciative that you might have other options that you're looking. So, yeah, the time frame should be set by you. Really, you shouldn't be dictated to by a practice. I think. And I think there is a balance to be found there when you say, Vic, that
Yeah.
you need to be reasonable, but at the same time, I think that's where the communication factor comes in, like what you say about stating clearly what you're looking for. I think if you're communicating that from the outset, and they know all of the moving parts that are involved in that process, it's going to be a lot more of a smooth process, and hopefully a better outcome.
Yeah, absolutely. But also, you need to be aware that the practice will need to know in a reasonable period of time.
Yeah.
So, although it's understandable that you're going to have other options, maybe that you want to consider, the practice can't be waiting around for a months on end while you make a decision as to what you want to do, because it's important to them to get a GP on board
Yeah.
as well. When you arrive at the practice, what are your first impressions? What are the state of the premises? Is it modern purpose built? Is it older? Does it need updating? What could that possibly tell you about the practice? And what do the staff look like when you arrive? Are you greeted with a
Yeah.
smile or with a really depressed looking receptionist? And how do the patients seem? Are they quite happy sat in reception? All these can be give you indicators as to what it can be like to potentially work there. And why are they recruiting?
Mm.
Has there been, where's the vacancy come from? Is it retirement,
Yeah.
which is, quite the genuine reason, or do they have quite high staff turnover? And if that's the case, why is that the case?
Yeah.
Um,
I mean,
uh,
even a GP, if you're replacing a GP that's leaving, that's not necessarily a bad thing. It's just finding out why that GP's left. I think that's a question that 99% of the time GPs don't ask. They don't ask where the vacancies come from. They just see there's a vacancy, and I think you need to know the origin of it because that's going to tell you a little bit of a story. And um, as I say, a GP leaving can be fine. They might have left to do something completely different, but if they've left to join another practice locally, why?
yeah, absolutely. I mean, a lot of the time I deal with practices, and the reason they need to recruit is mainly retirement or a GP is
Yeah.
completely relocated. But yeah, if somebody has joined locally, then why has that happened? Also, how many locums might they be using? Are
Mm.
they long term? Why does that mean they can't get salaried GPs? Or it might just be maternity cover, which is, fair enough.
Yeah.
Um, and how many GPs have they got to the list size? Is there a good balance? Have you
Mm.
got enough patients that you can manage individually? So again, these are all things to consider. And
I
how
agree.
long have people been there? Have GPs been there quite a long time? If so, it must mean that they're happy
Yeah.
and settled in the practice and the team that they're working with. And how's the partnership looking? How long have they been partners? How big's the partnership? All these can
Yeah.
be telling signs as to the stability of the team, the happiness of the team, and also if you're interested in partnership, is the opportunity for you to join that partnership.
The age thing I think is key there as well with the partnership because if you are interested in partnership, yet there's 5 partners there and they're all within 5 years of retirement age. Are you going to be left holding the can, so to speak, in a few years' time, or can you see clear succession? Are there a couple of partners in their 40s, or one or two in their 50s, and then one or two in their 60s, so you can see the next generations coming through.
Yeah. Um, And what do you want? What do they want? What's their ideal candidate? We know
Yeah.
it can be a candidate market at the moment, but obviously they want somebody right for their practice. So it's
Yeah.
always good to actually ask them, what do you want in a GP? And I had that recently with a practice, and they absolutely loved the fact that the GP
Goes
took the
down really
time to
well.
ask. Yeah,
Goes
it
down really well,
does.
doesn't it?
It shows
I
that
think
you care.
it does, but I think it's important to ask it as well because practices at the minute, a lot of them are desperate to recruit, and they are going to probably compromise and just recruit a GP because there's a GP available. But I think you need to know if you are what that practice is looking for, because if you're not, and maybe they are compromising in certain areas, what's that mean for their expectations of you? They might compromise on what they're looking for, but their expectations probably won't change. They'll still expect the same work or um the same return on things in future. So I think you need to know if you do fit the profile, whether or not they've offered you a job. I think that's equally important as actually getting offered the post itself, is knowing that you are a fit for it.
Yeah, because you've got to be happy as well. And if they're
Yeah.
expecting things that you're not comfortable with, then obviously that's not going to work out for you at
Yeah.
all. How ambitious are you? You might want to develop specialist interests. Can they support you with that?
Mm.
I have a lot of newly qualifying GPs wanting to do the fellowship scheme. Can they support with that fellowship scheme?
Yeah.
And who else works there? How many other clinical support team are there? Because they can obviously take quite a lot of the workload away from the GPs in terms of not just patients, but admin and even home
Mm.
visits. So who else is there and how do they actually support the practice? And what's being done in terms of workflow optimization, admin support? Are you going to be bogged down with admin all day as well as seeing patients? Or is it quite streamlined? Is there a really good back office function at the practice?
Mm.
And as we mentioned before, start and finish times, what kind of flexibility is there? Do you need flexibility? And what time do they expect you to stay there? Not just on a normal day, but on a duty doctor day. And what
Yeah.
time are the normal GPs getting out on a night?
Yeah.
Are they getting out at a reasonable time, or are they stuck there till like after 7 o'clock at night,
I think that's
finishing admin?
okay. And you want those relevant examples, and it's said, oh well, there is flexibility. Okay, right. Well, who's using that flexibility? Is it he's saying there's flexibility, but everyone starts at 8:30. You think you need to actually ask for some specific examples. Okay, well, who has a working pattern that might differ a little bit? Because flexibility is a bit of a buzzword these days, isn't it? They just
Yeah.
it's banded around. Then you probe a little bit deeper, and it's pretty rigid. So yeah, you want to actually see some case studies of flexibility being employed.
One of the most important things that GPs want to know about, and understandably, is workload.
Yeah,
So, we know that everybody would love the 15-minute appointments, and yes, practices out there can offer it, but most of them don't, and most of them do work to 10-minute appointments. So, how comfortable are you with that?
yeah,
Most of them will be about 15 patient contacts per session, but I think it is important to have a look at the screens, see what they tell you, how many extras are they
yeah,
dealing with, is it realistic, and are you going to be able to manage that, especially if you're newly qualified and you're getting back, you're getting into the swing of being a qualified GP. So just make sure that's
yeah,
something you're going to be able to manage. A lot of practices will give you a really thorough induction program,
yeah,
and they will start you on lower patient numbers. So you can build yourself up slowly but surely. But just, be aware of the end game and where they expect you to be after, say, a month or so. Um, and what is required as salaried GPs in terms of additional responsibilities? So again,
yeah,
a lot of them, for a newly qualified, won't throw loads of additional responsibilities at you, but it can happen. And if you are an experienced GP, this might be something they will expect of you. So they might expect you to lead in a certain area, maybe deal with QOF, maybe help with the training side of things,
yeah,
if they're training practice and supporting other GPs joining the practice. Are you okay with that? Is that
yeah,
something you're interested in or not? And duty doctor, I touched on it very briefly earlier. What does that look like? Is it realistic? Are you on your own dealing with it? What's the list size in association with all the responsibilities you're going to have?
yeah,
I've got massive practices that you will have like maybe two duty doctors or a duty doctor and a nurse,
yeah.
or a smaller practice sometimes doesn't have a duty doctor day at all because there's just so few GPs working there, so they
They all
all
they all
they all
work same
work
day. Yeah,
together. Yeah, but
yeah,
then that might affect extras. So, you need to see the screens, you need to know what that's going to look like.
yeah,
And if you have got, commitments outside of work, childcare concerns, and
yeah,
they've got extended hour expectations, do you have to take part in that? If so, when, how frequently, what's it look like? When are you going to
yeah,
get out? Are you going to have to be in early? Are you going to have to stay really late? Can you do that? Because if you've got to take part in that, you can't then start at a practice and then a week or two in go, I can't do that because I've got to be home for the children. So,
yeah,
you be aware of extended hour expectations well before you make any commitments to a practice.
yeah,
And once there is an offer made, what does the contract look like? Everybody would love the BMA model, let's face it, but a lot of practices can't do the model, but they will offer something very, very similar
yeah,
to the model. So be realistic in your expectations as well, but thoroughly read through it. You can send it to the BMA for check-in; they'll happily do that. Um, or you can even have a chat with any of us and go through
yeah.
your contract. We've got a pretty good idea of what
We
is
see hundreds of
important.
them.
Yeah,
Yeah,
absolutely. So I've done that many a times, and sometimes GPs haven't fully understood what it said, and we've been able to explain that. So we're happy to help as well. Be aware if you do send it to the BMA, it'll take them about a week to get back to you, and generally they will give like at least one page of A4 full of stuff. Don't let that
oh, yeah.
scare you.
They could be quite
Sometimes
militant, can't they?
yeah. Sometimes they do misread things as well. And this happened only last week where they said a GP had not given enough holidays, not been given enough holidays, but that GP was part-time. And so the holidays were prorated. So I had to explain all that to him, and he
Yeah,
understood it in the end.
I think that ties in nicely, like with where we ended things, though, because we ended things with the benefit of working with Menlo Park and what we actually offer. So, you could be watching this podcast and even the actual webinar that we did and thinking this is a massive amount of information to take in.
Mm.
How am I supposed to remember all of these questions? If you work with us, you don't, because we're asking those questions for you. We've found out all of that information about the practice and where the vacancies come from and how they're working, how the duty set up, everything that you've just covered, Vic. We did all of that before we speak with any GP, and so you get that overview. You get that extensive overview, all the fact-finding questions is that there and available for you. Um, we qualify you, the GP, as well, though. So as much as we qualify the practice to the nth degree, we do that with a GP. So we're really trying to find out what makes you tick as a GP, what your motivators are, your push factors, your pull factors, your what's on your shopping list basically when you're looking for a practice. And the better we understand you, the better we're going to find a practice that fits with that, and vice versa as well. And then I think again you were speaking about it there about what happens with the contract and the BMA getting involved, and I think they're a useful service, but like I say, it can be a bit militant and it's not always relevant. That's where our involvement can be key, because we can pick through those bits and say, well, that bit's important, we need to address that. That bit's not important. That bit's important, we'll address that, but that bit's not important. We'll go through that with them. So yeah, just actually helping with the negotiation of the contract, but the salary as well. Money's not a comfortable topic for a lot of people to discuss, but we discuss salaries all day, day in, day out. So we're quite happy having that chat on behalf of GPs and negotiating the best deal for you. And then once you're placed, you're in post, you're hopefully settling in well. There's the aftercare element as well that we offer. So we check in with all of our GPs and our practices a minimum of 2 times after they start, to make sure that everything is going okay. And if there are any issues that have arisen, we can mediate those. And typically, issues that arise, the quicker they're dealt with, the easier that they can be resolved. So yeah, it's a pretty all-encompassing webinar. I'd like to think we covered a lot. We had some really good questions as well, didn't we? Kind
Yeah,
of
we
throughout,
did.
and then there was a Q&A section at the end where there was something like a dozen really notable questions, which hopefully you'll find useful as well.
I mean, just to touch on the questions before we wrap up, we did have a couple of GPs that required tier 2 sponsorship and they wanted
Yep.
to learn more about that. We try to educate practices as we go about tier 2 sponsorship. We've even provided them with a guide on how to become a sponsor, and even a guide on how to allocate a certificate of sponsorship number once they have that GP in place.
Yep.
So we can help with that, and we've worked with lots of tier 2 GPs that need the visa, and so we can certainly help with that. But before we wrap up, one more thing. We need to put a myth to bed, because I've had this a few times. There's a bit of a rumor that if a GP works with a recruitment firm, that this will affect their salary
Oh
and
yeah.
they have to pay. That's
Yep.
absolutely not true. It does not financially impact the GP in any way, shape, or form. So please
Yep.
spread the word.
Here, here. Brilliant. Well, yeah, hopefully you find this useful, and you go and actually look at the full length version on YouTube. So if you'd like to get a link for that, get in touch with us today, and we'll can send you the link to the whole series. But for me, thank you very much.
And we look forward to hopefully speaking to you soon.
Take care, guys.
Bye.